And on to a tragic story from Meghalaya now. So has a containment zone become more of a stigma than a measure to contain the spread of COVID? Well, the stigma surrounding a containment zone has claimed the life of a newborn in Meghalaya capital, Shillong. A newborn baby died in a government-run hospital last night shortly after its birth, raising a lot of questions on the handling of the COVID situation, especially by non-COVID hospitals. The mother of the child had to face humiliation earlier in the day when she was refused admission to the hospital as she came from a containment zone in the city. Denied admission by Ganesh Das Hospital, the woman was rushed to another city hospital which also refused admission. Later, following intervention from some pressure groups and DHS Dr Aman War, the woman was called back to Ganesh Das Hospital where she delivered the baby at night, but unfortunately the newborn passed away. Reacting to the incident, President HYC Maulai Circle, Dongboklang Karlingdo, said that the health authorities should have been prepared to deal with cases other than COVID. He questioned whether all patients hailing from different containment zones will have to go through the same ordeal.
Yesterday at around 11:30, we got a complaint from one person from the resident of Malay itself. It means from Malay Motoa, and that the family members they went in that hostel, Ganesh Das Hospital. They're supposed to go and admit one of their family members because this woman, she supposed to give birth for her first child. So when reaching there, they have they go first in that emergency ward. So when they came to know that these people, they came from the containment area, containment zone, these people of Ganesh Das, I may say the staff and even the health workers are looking for the good and betterment of people. They refused and they said that now we don't have any bed for in the isolation ward. So after that, these people from Malay Motoan, containment zone, they shifted to the Robert Hostel, H. Gordon Robert Hostel. So while reaching there, also again the excuse from the higher concern that we don't have any doctors to do the operation and you better go. Again from the Robert Hostel, they refer to the other hostel like Nazareth and Woodland. The night time around 7:38, again we got a phone call that after admit the baby wasn't she's supposed to give birth, she already expired.
Meanwhile, the Meghalaya government has issued a show cause notice to Ganesh Das Hospital over the incident. However, Director of Health Services Dr Aman War claimed that the newborn did not die due to delay in admitting the mother but due to other complications.
By virtue that she had come from a containment area, so it is the protocol that once you say containment area, there is every likelihood that the patient may be infected. That is why we contain the area, we do all the testing. So to mix together the patient with the general patients, that is out of the question. And when she was diverted back to the COVID area, the isolation ward, all the 5 isolation beds were full. And because of that, the patient was advised to go to another hospital. So when we had gone there, what happened was that 2 of the patients who were there in the isolation ward were discharged because they were tested, they were found negative, so they were brought to the other side. So this patient had come in at the same time with me, and so we could admit the patient. And when the patient was examined, everything was fine, so she was admitted inside the isolation ward. And After the admission, after the examination, everything was found to be normal with the mother and the child. So no intervention was needed immediately. However, in the evening time, in the process of that birth, like any other case which happens during delivery, there was this birth asphyxia, we call it, and that is why the baby had expired. It has got no relation with the time of admission of the patient.
Meanwhile, Dr. Aman War also informed that 2 vacant halls of the hospital will be used as isolation wards.
Now, after I had seen that hospital, the baby was admitted, what we did was that we said that now expect that you will get 5, 6, 7, 10 patients from different zones. So we have to be prepared that if such patients come, Ganesh Das will be able to accommodate these patients. Not only Ganesh Das, all the other government hospitals, private hospitals, we're going to have a meeting with them. Now, for that, we had immediately went round that isolation ward. We saw that there were 2 vacant halls. So we said that these will be the places where we will receive the patients. If we don't have places in that isolation ward, we will receive them with all the physical distancing, everything, with all protocols to be followed. And with that, we are going to increase by 25 beds. 25 beds so that we can accommodate.